On the southern shores of Lake Victoria in western region of Kenya, KEMRI is undertaking a preterm birth initiative, PTBI research, in collaboration with University of California, San Francisco and the Migori County government. Preterm births are a major factor in the neonatal mortality in Kenya, and that is why efforts are being made to reduce the burden of preterm births, improve survival and quality of life for babies that are born before their normal term. Through a novel approach known as kangaroo mother care, preterm and low birth weight babies are constantly nursed in a concerted effort by their mothers and fathers through skin-to-skin contact.
I gave birth while the baby was weighing 0.965, and I thought that the baby could not survive. With this program, the baby has managed to reach this far.
KEMRI scientists in the field of perinatal, child, adolescent and maternal health are doing tremendous work, contributing immensely, not only in Kenya but on a global global platform to improving healthcare.
Deoxyribonucleic acid, though a tongue twister, is simply what we usually refer to as DNA. Its identification laboratory is up and running at KEMRI, providing DNA testing in the area of family relationship testing and forensic DNA testing. However, being primarily part of a research institute, the laboratory is keen on maintaining its institutional mandate. It is therefore focused on initiating research programs in forensics as well as offering training modules to graduates. The laboratory has provided DNA identification services during major national disasters in the country. In addition, the facility has provided capacity building for several clients, among them the National Police Service, particularly the Directorate of Criminal Investigations, to ensure quality investigations. KEMRI has constantly aspired to remain among the best in medical research. That spirit drives the institute to seek excellence in whatever they do. For instance, KEMRI is also ISO certified and keeps upgrading to the latest certifications. Currently, the institute is ISO 9001-2015 certified as a mark of quality standards in improving human health through research, capacity building, and provision of specialized services.
The office works with accreditation and certification agencies such as KEBS and SANAS, so that we are able to advise management on the applicable standards in the institute.
It has been a while since the World Bank supported the establishment of the East Africa Public Health Laboratory Networking Project, which is regional in nature. It involves Burundi, Rwanda, Uganda, Kenya, and Tanzania. The main objective of the project is to support the establishment of a network of efficient, high-quality, accessible public health laboratories for diagnosis and surveillance of TB and other communicable diseases. KEMRI's contribution to the network has been in the form of capacity building, mainly in antimicrobial resistance in the East African region.
We were looking at evaluating the new tools, new technologies, molecular tools, looking at how they perform. And we found that they perform equally in all countries.
Recently, we've been involved in trials that also target to reduce TB treatment to 4 months. So we are at the forefront of TB control and TB treatment.
With a critical mass of research data and evidence available and continues to be generated at the Institute through diverse efforts of researchers, it is only prudent for KEMRI to continue using such avenues as the KEMRI Annual Scientific and Health Conference to share its findings and experiences with fellow medical researchers and scientists who gather at the annual convention.
KEMRI, we have proper ICT programs that are able to communicate, able to link everybody so that the researchers are able to load their information and all the stakeholders who need this information can be able to access.
Eastern and Southern Africa's Centre for International Parasitic Control, ESASIPAC, is yet another platform for exchanging information on prevention and control of parasitic diseases. Being a regional consultative gathering of scientists on how to combat parasitic diseases within their respective countries, a lot takes place in terms of information sharing at the periodic conferences of ESASIPAC.
It is through ESASIPAC and the work that we are conducting that we have trained the 16,000 primary school teachers across the 27 counties in the country who are deworming the school-age children in the last 5 years, that is 2012 to 2017.
Parasitic infections continue to be of major public health concern, especially in developing countries. Efforts towards their elimination have not yielded the expected results due to reinfection after each treatment. So far, the only recommended strategy towards reduction of parasitic infections is through mass administration of drugs.
We are currently doing mass drug administration in the schools in Western, Nyanza, Rift Valley, and the coast. A total of about 20,000 school children are dewormed.
We have a few scientists here who are very critical in guiding that process within government, and they participate with the other institutions at the Kenya National Bureau of Standards to at least give guidance on the critical methodologies that need to be used.
True to its mission, which in part supports provision of training, KEMRI is indeed committed to developing and nurturing young scientists in the field of health sciences. In collaboration with the Jomo Kenyatta University of Agriculture and Technology, the institute offers master's and doctoral training in health disciplines at its Graduate School of Health Sciences. All this is happening in the knowledge that the future of medical research at KEMRI rests in their hands as they wait in the wings to excel.
Our program is actually 3 years, 3 years, 4 years, 4 years. And the reason why we are having it that time is that we want students who are full-time students.
Through painstaking research, KEMRI has over a period developed various diagnostic kits and other health products that include TB-Side, a standardized disinfectant, KEMRUB, a hand sanitizer, KEMPREG Rapid, a pregnancy test kit, and KEMRI ready-to-use culture media.
We have KEMRI on board, which is producing the sanitizer. So we want to encourage local consumers to use local products that are being manufactured by KEMRI. KEMRI products are quite affordable, cheaper compared to the imports that are coming into the country.
We are manufacturing this product together or in partnership with local pharma companies.
And in the course of its research programs, KEMRI has also developed linkages with premier international institutions such as the World Health Organization, Japan International Cooperation Agency, U.S. Center for Disease Control and Prevention, the Walter Reed Army Institute of Medical Research, Wellcome Trust UK, United States Agency for International Development, British Medical Research Council, Royal Tropical Institute Amsterdam, and the World Association of Industrial and Technological Research Organization, WITRO.
We have various partners, both local and international, and this is an area that we put a lot of emphasis in terms of building sustainable strategic partnership and relationships.
I see the collaboration between KEMRI and MRDK and RARE, our headquarters, expanding. Certainly the potential is there.
I think the future is very light, and I want to have more activities, and the Nagasaki KEMRI partnership must be strengthened more, and we have more collaboration with KEMRI.
So over the next 5 or 10 years, one of the things that I'm most excited about is the breadth and ability of young scientists coming up.
We are also accountable to ensure the finances we receive from them are well controlled, they are well accounted, there are no leakages, there is no fraud, everything is done according to the Public Finance Management Act.
Collaboration is paramount in any undertaking of the magnitude that KEMRI has been engaging in with respect to sourcing for revenue or funds to support research, also training and many other things that go with research.
KEMRI is a health research institution with a formidable research culture that is robust, responsive, and result-oriented. It is for this reason that it has developed a critical mass of scientists, technical and support staff that have been able to turn it into one of the best research institutions globally.
The innovations, the work that is going on within KEMRI is appropriately documented and shared. It will clearly contribute to the development of policies, to the development of strategies, and to the strengthening, to the improvement of the quality of service.
We in KEMRI continue to engage the government to continue to support research in this institution to make it possible for us to provide them solutions that are so much needed in managing diseases.
And as the Institute continues to set its sights on the horizons of medical research, all it can do in the interim is to keep breaking new grounds in search of better health.